State Health Foundation. This webinar, COVID-19 and its impact on survivors of domestic violence, is part of the Foundation's Practically Speaking webinar series. Today we'll be discussing how the coronavirus pandemic interacts with domestic violence risk, and our speaker will provide some guidelines for working with survivors. Before introducing our presenter, let me go over a few housekeeping items. First, the webinar is being recorded, and a recap with a link to the recording will be sent out afterwards. The video and audio are any questions or comments you have into the chat box during the presentation. After the presentation, I'll read the questions submitted through chat for our presenter to address. With that, let me introduce today's speaker, Ashleigh Washington. Ms. Washington is the Senior Director of Learning and Staff Development at Safe Horizon, which is the largest support agency for survivors of domestic violence, sexual assault, child abuse, and human trafficking in the United States. She is a social worker and a doctoral student in the social welfare program at the City University of New York. And now I'll turn it over to Ms. Washington.
Right. Thank you, Jessica, and thank you all for having me. I'm going to share my screen now. So today I'm going to be talking about, just what Jessica said, like how is COVID-19 and this pandemic really impacting the issue of domestic violence, which we all know is a longstanding major public health issue. So thank you for having me at a time that is so pivotal in all of our lives, personally and professionally, and also in the effort to support survivors of violence. So at Safe Horizon, I oversee all learning and staff development, and that is a very fancy way of saying that I help train and advance knowledge for all of our staff who work with victims of crime, violence, and abuse. At Safe Horizon, we have over 1,000 staff. We serve over 250,000 New Yorkers, including children, adults, and families each year. And that's through our hotlines, our child advocacy centers, our court programs, and our 8 domestic violence shelters, among many more advocacy and legal and court programs. So a large part of my role is helping to advance this knowledge. And for the next 15 minutes, I want to talk about the types of abuse, how COVID has served as a major risk factor and presented some challenges for the work around domestic violence, and some safety assessment and practice considerations that you might bring to your own work. And then we'll have some time for questions. But as a reminder, for some, this is what we are talking about when we talk about domestic violence. Domestic violence can take on many forms, as you see here in this outline. It can be physical, financial, verbal, it can happen online, and there's a huge emotional toll that it has on victims. And it's important to remember that these tactics don't take place in isolation. We'll hear a lot of people say that physical, is one thing, and then the emotional has an incredible toll, and that's even worse for victims. And the truth is, these types of abuse don't happen in isolation. If someone is experiencing physical abuse, it's likely that that has an emotional toll and a whole other web of power and control around it that's causing harm to that person. Also, at Safe Horizon, we are very conscious of the fact that these types of abuse, like going through someone's things and acting extremely jealous, or taking control of their social media, or preventing them from taking their medication, all of these different things can happen in various types of relationships, not just heterosexual relationships, but same-sex relationships, young adult relationships, older adult relationships, and across various identities and socioeconomic status. So we really think about a very broad anti-oppressive approach and the role of marginalized identities and layered identities when we think about violence. One of the abuse tactics that are underlying all of these you see on the screen is coercive control. And these are the very insidious tactics that deprive, exploit, and regulate victims' behavior. And it's used to intimidate them and really reinforce some of the physical abuse and enforce other non-physical controlling behaviors. Such as, preventing someone from seeing their family, or a lot of times victims may be coerced or forced into behaviors and crimes that puts them at risk. So sometimes at Safe Horizon, we see that where this person is a victim of a crime, but they also may be involved in systems because of the nature of the abuse. So it's just important to remember that it looks wide ranging and it's unique to the individual in their own experience. I know you all probably might be familiar or in the past seen the power and control wheel, which kind of outlines all of this. And it just really goes to show that beneath all of this is this idea of power, control, and these different types of abuse will manifest and can look different. And they change when circumstances change. So what we're seeing now in our time, the last few months, is the impact that COVID has had. It has had a tremendous impact. On any given day, so many factors impact our work with domestic violence. And on any given day, DV is a major public health issue in this country with all sorts of confounding variables, which you see here on the screen in this circle. Right now with COVID, things like isolation, limited family and social supports, which are already a source of control and power on any given day for people in domestic violence relationships. But now with it being enforced in our environment, in our society to control the virus, people don't have the normal outlets or abilities to counter some of these forces like isolation. Like normally people can go to work, they can drop their kids off at school, they may have a doctor's appointment or something like that that they could go to. And now people don't even have that to seek help, which is causing this increase in not only incidents of violence, but also the lethality and the severity of the violence. Factors like unemployment, reduced income, normally are shown to correlate with domestic violence. When someone loses income and there's more stress, you tend to see more victimization and abuse. And with COVID, with unemployment, with people drinking at home where someone had a substance dependence or something like that, the person who causes harm might do that outside the house. Now that's not possible. So these are all the factors that really increase risk for victims. And what is really important to think about as well is the life-generated risks, such as poverty, racism, disability, systemic oppression, especially for people of color and people of marginalized identities and abilities. They may have greater risk because they may be more dependent on someone else, or some people may not feel as comfortable seeking help. And it can become another source of power and control where people don't feel like they have other sources of support. So a way of thinking about this is anybody who was already part of a marginalized group on any given day during COVID and is a victim of domestic violence stands a lot of more vulnerabilities right now. We also imagine that right now, a lot of victims who want help, they want the violence to stop. They don't necessarily want systems involvement because it can make their lives more complicated, especially if they've been systems involved or if they're a person of color or whatever their status is in this country or their gender identity. It makes it harder for them to want to seek help. And a lot of times they don't want their partner to go to jail, especially right now where there's a pandemic. They might care about this person, want the violence to stop, but they don't want this person going to jail where they could potentially contract COVID, which is a life-threatening disease. So it's so complicated, our response. So some safety assessment considerations for the pandemic is really to think about how might a person be more vulnerable right now, or how might their access to resources and getting help be different. So we think about existing safety plans, something that someone was already doing to keep safe and manage danger, or resources they accessed are more limited now. Isolation can be used as an abuse tactic. As I mentioned, the virus might be used as an abuse tactic. At Safe Horizon, we've seen a few cases where a person's partner is positive for COVID and trying to cough on them or maybe spitting on them and trying to infect them with the virus. So it's being used as a tactic. We have seen a case where someone is an essential worker and the partner doesn't want them going to work and is controlling their behavior. Or if they go to work, not letting them back in the home because they've been exposed to COVID. So really using that job as a financial resource against them and using the virus as a way to control their behavior and abuse the person. Financial abuse can intensify at this point because people also may have limited resources and times can be really hard and stressful. So the finances can become another source of control, abuse, and manipulation as well. We've also seen where children have been used to manipulate and control during this time. For instance, a survivor might have a court order with supervised visitation, or maybe not supervised visitation, but visitation order, where the children go with the other partner for the weekend. And the partner will say, well, I'm not bringing the children back to you because of COVID-19. Or I'm going to tell our kids to do this around you because of COVID-19, or I'm only going to bring you one child back. And while that's not a physical form of abuse, for people who have had a long history of abuse and other victimization and had that abuse with that person, that is very traumatic to know that your children are not being brought back to you, and worrying about their safety. And also just the trauma of having to navigate systems as well during this time, and seeing the person use that as a source of control. Other things to consider is, how might the news or information be restricted from this person? Access to a phone will be limited. They may not have internet, or may not be able to use these things at a safe time. At Safe Horizon, in the early days of the pandemic in March, and probably through May, we saw a lot of our calls on our hotlines were very quiet and very, I guess, neutral in language. Like the person couldn't share a lot of detail, for lack of a better word. They didn't have a lot of time to talk, and they didn't go into a lot of detail because they just didn't have safe access to call the hotline. So they were doing the best that they can. So when working with survivors now, we're even more cautious when we're assessing and we make a call and we're interacting to figure out what is the nature of their environment right now? What is around? What is a safe word that can be used? If we get hung up, will you call back? Or just planning through those safety things and using different words and stuff to communicate. Also giving survivors different ways to reach you, just in case that one mode of communication that they had becomes unreliable. So email, or being able to text or being able to call is important. They may have limited access to groceries, medication, and supplies. Like grocery store lines are super long these days. Well, it seems like it's calmed down, at least in the city, but this is another barrier we've seen with survivors is their ability to go and get groceries and medications is being restricted, or in their neighborhood where they live, there might not be as much available, or there may be very long lines. So really, these questions are designed to really think about not just the physical safety we always hear about, that is important in figuring out what's going on for victims and what's most important to them in the moment, what feels most urgent. What we've seen a lot right now is being able to attend to the basic needs that people have. So if someone needs food and they can't get food because of the nature of their circumstances, in some of our programs, we made sure people had gift cards and things like that. So they have some control over being able to get things. In our shelters, this is easier where people are not in immediate risk for violence. But on our hotlines and other programs, we've tried to provide ways for people to feel biologically safe and physically safe in other ways, safe around their mental health when they're in a situation that they cannot leave. Also, the impact of trauma is very important for emotional safety. You want to assess, everything that's coming up for the person in your interactions with them. A lot of people have experienced multiple traumas and difficult experiences before the pandemic, and the domestic violence itself is a traumatic experience on top of a pandemic. And a lot of people are experiencing a lot of grief. There's been a lot of loss among the clients that we serve. They've lost people. They also have their own history of things, and they might be going through this situation. And right now, that might be the thing they're prioritizing. They may be most concerned about their sanity and not leaving that relationship. They're just trying to manage it, but they're really concerned about their health and well-being on the day-to-day, and they don't know what to do. So in our programs, we have counseling services that are remote right now. A number of our clients we work with through our family and criminal courts, we're still doing remote services with them and just being there for support and really helping them to find other resources and constantly being there to assess what's going on and being able to support them. We found a lot of victims, especially calling our hotline, they don't want to order protection, they don't want police involvement, but they do want to report this to someone because they don't plan to leave unless things get absolutely so terrible, but they do want people to know. They want to, reach out and say, hey, this is happening to me. I don't know what to do. What are my options, right? And they may not necessarily be ready to go into a shelter or have the means to leave. So some practice recommendations that I've kind of touched on are really now more than ever, a trauma-informed, compassionate, non-judgmental approach to engagement is important. And what I mean by that is really respecting survivors' choices at this time. People are really prioritizing COVID safety over anything. So a lot of our people that we work with have children or have statuses in our society that don't make them feel comfortable to get help. And managing the danger feels safer while being healthy than any service referral that we could give them, than calling 911, than leaving their home or going to stay with a family member whose home may not be safe or where there might not be enough resources for them and their children or whatever their needs are. So really assessing what's most important to this person, being neutral and non-judgmental about that, and asking for permission to explore options that are realistic and authentic to them is so important right now. Offer remote and in-person options in your setting. So if a survivor is used to coming in and they don't have to come in, thinking about what telephonic services they could use. So if it's not a Zoom, a lot of things might be able to be done via text or over phone. At Safe Horizon, that's been something that we've been doing, is really offering people over the phone interactions, Zoom, WhatsApp, Skype, whatever tools are best for the survivor and what works for them. We've been trying to stay in tune with and meeting them where they are. And then really providing a predictable environment. If they do have to come in, you want to let them know what to expect. They're going to have to answer screening questions. Maybe they need to bring their own pen to sign anything so that they're not, using your pen or borrowing a pen, because a lot of people have anxiety about touching and getting COVID. Do they need to wear a mask? Do they need to enter a certain portion of the building? Have things changed about the way you interact with them? With all that's going on, you want to create that trauma-informed, predictable environment for them. Proactively identify current information for referrals, hotlines, shelters, and courts. One of the biggest challenges we've had is making sure people know that we're still open. And a lot of settings, a lot of anti-violence organizations and service organizations have changed the way they do services, but they're still available. So the information is ever changing, and making sure proactively you know what's available, what the hotline numbers are, and who's doing what is important. Always ask also on calls and things about current safety in the moment. Are they able to speak right now? Is it a good time? What does privacy look like or not look like for them? Is important. And you want to listen for verbal and nonverbal cues. So if someone tells you outright, I'm concerned about this and I'm worried about this, you want to find out what they've been doing to manage it, what resources they have, explore creative options for safety management. And use organic open-ended questions to find out more and what they might be afraid of. Sometimes they're not going to tell you. You'll hear things in the background, or the call might drop, or they're talking very quietly. Those are things you want to tune into. Authentic, realistic, and doable or time-oriented safety planning options are key. Being in tune with what's real for the person. Calling 911 is what a lot of people will do in their worst case circumstances. Others, that is the last thing they want to do. So safety planning options that are authentic to who they are, their identity, their lived experiences are key, and realistic things. It's not always realistic for someone to go into shelter, especially if you are a single woman, for instance. It's hard to get it. There's very little shelter beds in New York City, at least for single women. It's really geared toward women with families. So leaving and going to shelter is not always realistic. Attend to other basic, immediate social, financial, emotional needs. As I mentioned, people are prioritizing eating right now, having a roof over their head, and not getting COVID. So sometimes mediating some of those basic human needs will help them to better manage whatever else they're going on in that relationship, at least in the short term, today, tonight, tomorrow, over the next week. Sometimes survivors are not prioritizing the physical things that are going on. Doesn't mean you can't ask about it, but attending to some of the other things people are finding is even more, just as valuable to them. So in short, really respecting their choices and finding out what's possible for them, what's authentic and realistic for them is really key right now. And this is just an overview of letting everyone know, Safe Horizon is here for survivors. We work in the 5 New York City boroughs. Our hotline is 1-800-621-HOPE, and that's how survivors can get screened for our domestic violence shelters throughout the city. That is the route to the shelters. We also have a safe chat function on our website at safehorizon.org where people can chat and text, because we found that that's safer for victims and more than calling. And a lot of, we've seen with this intervention, younger people are using it as well who might not have called the hotlines. Counseling centers are also available for survivors if they just need that type of support, and they're doing that remotely as well. So I guess we'll do some questions now. Stop here.
I was muted. Thank you so much, Ashleigh. This was really a great introduction into the importance of trauma-informed care, especially during a time of, the pandemic and other social upheavals that we're seeing today. I have a few questions, and I'm welcome questions from our viewers as well. So in terms of a rise in abuse during the pandemic and sheltering in place, I'm thinking about some of the really vulnerable populations and especially minors who, we often think of domestic violence as a heterosexual couple, but minors are often involved in domestic violence. And at least in April, there was a 22% increase in calls coming from people younger than 18 to the Rape, Abuse, Incest National Network. And, so physical and sexual abuse of minors is often flagged by mandated reporters, and since they're not in school, they have fewer opportunities to access help. Are there strategies you would consider for proactively reaching minors who may be suffering from this greater severity and frequency of abuse?
Yeah, so we've been talking about that within our organization as well. We have 2 programs that directly serve youth, our Street Work Homeless Project for homeless youth and our child advocacy centers. We've definitely seen decreases initially in calls to the state central register and decrease in calls coming to us. And what we saw was a lot of the children were coming through relatives who found out about something that happened to the child and would bring them in, like friends of the family or relatives, and a lot more of just 911 calls directly versus to the state than to us. So we have found that we're working really right now on creating a site specifically for young men of color, victims of crime, but also might be victims of abuse. And that's been one way that we've been striving to engage. We also have our Safe Chat, which we launched a little bit before the pandemic, and we've been working with the city to push out information about it. And I believe the city has texts that are going out to young people and educating people about what's going, that this is still going on, violence is an issue. So I don't know if in your settings, it might be helpful to reach out to any organizations that you collaborate with or that you partner with. I don't know if like Parks and Recreation, school staff who are still working to do free lunch or anything with summer programs. I know there are some camps and things going on. Our work primarily with youth is through our street outreach and youth who come to us, and then through the state or through formal channels. So it's hard to say, what would be best to reach them where they normally wouldn't otherwise come. But
So, and then kind of dovetailing on that, talking about your Safe Chat feature, I had been reading about some work out of Northeastern School of Law that they've developed both an intake form on the web so that people don't have to call, they can do the form sort of with maybe a little more privacy, as well as developing an app that survivors can use to document their experiences of abuse. Of course, this is from the law school, so it has this really important focus on documenting. So this was just released on July 1. There's no data yet to sort of show how well it's being used or difficulties in rollout. But do you think that this movement towards tech innovations in the domestic violence space will have a notable impact on survivors' ability to get support, especially during something like COVID?
Yeah, we think making technology accessible creates more accessibility, right? The technology is just another tool. We're seeing this with not only our Safe Chat function online, but also with our counseling center, with our Safe Way Forward program, which works with the whole family who's been involved in domestic violence. And that program is designed to be remote. So technology has definitely helped us leverage just connecting with people, new existing clients, and people who are now experiencing challenges. So it definitely makes it more accessible. One of the things we're being mindful of is how it also can be unsafe for people if they have something on their phone that is tracking things or is about DV or something like that, how it can also be a risk. But that's, risks are present in across different circumstances. So it really depends on what is the survivor's sense of safety, what are their abilities, that's another thing, their ability to interact with technology, either audibly or visually, and just their overall environment. But it definitely, we've seen it definitely reach victims who might have not have otherwise called the hotline or come into one of our precincts or programs.
Okay, so we have about 2 minutes left. So one other question I wanted to talk to you about, I have a question here. I'm curious to hear that there has been an increase in dependency on a partner's health insurance with the mass losses of job-based insurance. Can enrolling people in the healthcare marketplace be a strategy to helping survivors regain independence or safety?
That seems like it could be an option. I think many people benefit from getting insurance through the marketplace. I think it really depends on what the survivor considers as independence and safety. If healthcare access is a barrier and the marketplace is going to make it easier to access care, it's going to provide them with the care they need for their abilities, or if it's racially responsive to them and their needs, I could see that being an option for survivors. I think resources would be helpful to the extent that the process is helpful for them. But I think, that would just depend on the person.
So we're just about at time. So I just want to conclude our presentation. So first of all, thank you so much, Ashleigh, for joining us, and for everyone who's attended the talk today. As a reminder, a recap of the talk with a link to the recording will be sent out later, and it will have all the resources that Ms. Washington sort of shared with her slides. Also, please consider attending the next webinar in this series entitled Partnering with Minority Patients and Families on Healthcare During COVID-19. That session will be held Wednesday, July 29th at noon. So thank you to all for joining us, and I hope you join us for the next event. Thanks again, Ashleigh.
Thank you. Bye, everyone.